We're about to receive a helicopter with a person in their 60s who is involved in a high-speed car accident, car versus pole.
Sharon.
A 60-year-old woman has been trapped in the car for 90 minutes. The early reports from air ambulance are that this woman is confused. That makes me very worried about a head injury. Hello.
The patient is Sharon, a mum of 4 who was driving home when she was T-boned at an intersection, causing her car to spin and crash into a telegraph pole. Sharon's dog Nemo was in the car with her when the accident happened.
Hello. You're pretty sore in that right arm.
Yes.
What's your name?
Sharon.
Sharon. Nice to meet you, Sharon. I'm Emma. We're going to move you onto the next bed, and if you're in pain, we'll give you more pain relief, so don't worry. 1, 2, 3. There you go, Sharon.
With Sharon's car having smashed into a pole, Dr. Emma is concerned that the huge force may have caused extensive internal injuries.
Just going to do a little ultrasound of your chest. Where were you headed, Sharon? Were you off to work or...?
No, I just finished dropping my son off and heading home.
He was going to work, was he?
Yeah, I dropped him off.
You're worried about your daughter?
Yeah, she's at home.
And does she know?
I just opened no.
Okay.
The 60-year-old's family rely heavily on Sharon, including her elderly mum, Leonora, who lives next door.
I always ring her at 8:30 to make sure that she knows I'm awake and I'm out of bed. We go shopping and then we go to bingo. Oh, I love her so much. I really do. Sorry. I mean, she'd better not leave me because I don't know what I'd do without her.
She was trapped for quite a bit of time mechanically in the lower limbs.
That's all where I'm pushing?
She also got right humeral and radius ulnar, which is her main concern. Splintered right arm, pelvic splint in situ.
The paramedics are very worried about an injury to this woman's right upper arm, but they're also worried about a pelvic injury, lower limb injury.
Does not recall the event.
How fast were you going, do you
I
think?
don't know. I didn't even know I had an accident.
Yeah, right. She has no recollection whatsoever of the accident. That's got me very worried that she could have quite a significant head injury.
Right rib, pelvis in a binder.
A little bit low, Annie, the binder.
She does have a tender medial left ankle. All right, so priorities X-ray are on their way.
Working alongside Dr. Emma is emergency doctor Emma Moore.
Then we'll try and get her to the CT.
No.
Okay. Right. Yeah, I noticed, yeah.
The severe pain in Sharon's upper arm is ringing alarm bells.
So, like,
Yeah.
that's off kilter
Yeah.
compared to that side.
Yeah, it is. It's shortened and it's sitting up like that, isn't it? Sharon's arm is hard like a rock. There's clearly significant bleeding. I'm really worried about a broken bone. It actually poses a risk of the pressures within that compartment becoming too high, something called compartment syndrome. And that's an emergency that's going to require an operation extremely urgently. This is
So
very
definitely-
deformed and hard.
The morning has been a pretty standard morning.
Emergency doctor Sarah Whitelaw may just be beginning her shift, but it's far from the start of her day.
Trying to get everyone to work in different places and to school on time. Feels kind of like worked half a day before you get here.
And the pace doesn't let up as she hits the ED floor.
Good morning.
Dr. Sarah's first case has arrived.
Alex here for you?
I'm Sarah, one of the emergency doctors. Welcome to the Royal Melbourne.
The patient is 46-year-old security guard Alex, who had just finished mowing a paddock on his family's property when the gruesome accident happened.
Tell me what has happened.
I'm riding a ride-on mower. I've
Yes.
stepped off the garden where it's supposed to be, and I've stepped in the blades. So,
Okay.
and the blades are still engaged. So
Okay.
I've stepped down, my toes come into.
You stepped and then kind of pulled your foot away.
Yeah.
Why don't we make sure that we've got some pain relief?
Lawnmowers can cause a really significant injury that's life-changing in a matter of seconds. When I look at Alex's foot, I'm relieved. It's still attached, but there's a lot of blood on Alex's bandage, and I'm really hoping that the toes are not too badly damaged.
Who do you live with? Who's at home?
My wife.
Alex's wife Sarah was in the house at the time and called the ambulance.
I hear the mower stop and then I hear Alex yell out, "Sarah!" And I just knew from the tone of his voice that something was wrong. I'm a nurse, so I got up and ran over and I was already assessing the situation. I look down and I see that Alex has injured his left foot quite seriously.
I'm just going to have a look at the rest of you because I want to make sure that we're not missing any other injuries. Let's take this one off.
With Alex not having any other obvious injuries, Dr. Sarah needs to look at the wound, but is mindful that Alex will be in extreme pain, even though he's not showing it.
He just is going to need some more pain relief. I wonder if we just want to give him some intranasal fentanyl.
I'll go start setting everything out.
Yeah, awesome.
You're right, no rush.
As Dr. Sarah prepares to unwrap Alex's bandages, he shows her a photo of what remains of his steel-capped boot after the blade sliced through it.
That looks like you're not wearing that boot again. Looks like it's time for a new pair of shoes.
Looking at this photo, I'm really worried now that he might not actually have any toes left at all. Losing your toes can be a completely life-altering injury. It's a pretty small part of the body, but it's so important for the way that we walk and the way that we balance. So what we see when we lift up the dressing is going to be really important to Alex's life.
This is very deformed and hard.
60-year-old mum of 4 Sharon has a suspected badly broken arm after her car crashed into a telegraph pole.
Instead of the shoulder shoot through, can we do a humeral shoot through? I'll change the order.
Dr. Emma is worried that the break is so bad that Sharon's arm could have massive internal bleeding and lead to a condition called compartment syndrome.
So Sharon, what we're going to do next is do an x-ray of your arm that's very sore.
Yes.
It's likely that that's broken. A broken bone leads to bleeding and bleeding leads to increased pressure within a compartment. If Sharon were to show signs of compartment syndrome, she'd need to be urgently transferred to theatre to release the pressure in the arm.
X-ray.
Where is that?
Humeral.
Oh, ow. Good picture. That's sore.
All right, I'm going to get a CT of that.
Sharon's x-ray confirms a broken humerus. Essentially, the bone has been snapped in half. It would be extremely painful and potentially there's ongoing bleeding. So that still poses that ongoing risk of a compartment syndrome. That splint seems to be holding things in place. I imagine that's making it a little bit more comfortable.
Yeah. Just moving some stuff for the x-ray.
As well as the threat of compartment syndrome, Dr. Emma is now concerned that Sharon may have broken her pelvis.
X-ray.
Pelvis. So that's closed.
Yeah.
Which side she may be sore on? Right, left. It's an incomplete film. There's part of the pelvis that's been cut off by the x-ray. There's still a possibility that she's got a broken pelvis in there. The best way for us to know is via the CT scan, and so that's what we need to get quite urgently. Do you want to put another binder on when we log roll?
Yes.
The binder's too low, isn't it? Sharon's pelvic binder needs to be adjusted. It's just moved a little bit. So we're going to apply a new pelvic binder to really make sure that the pelvis is closed.
We'll put our binder underneath and then we're going to have to swap over once we roll that.
To be able to adjust the pelvic binder seems simple, but it's not. It's very, very tricky. You run the risk of moving the pelvis, and that's when it'll bleed.
On 3. 1, 2, 3.
And that's life-threatening.
Okay, are you going to be okay?
Yeah, fine.
Dr. Sarah is about to unwrap the toes of 46-year-old security guard Alex after he stepped off his ride-on mower and his left foot went into the blades.
I'm really worried that those toes will be completely gone.
Expecting the worst, Dr. Sarah will immediately send photos of the wound to the plastic surgeons in case he needs emergency surgery.
Okay.
When I lift up the dressing and look at Alex's toes, it's a really significant injury. The blade has macerated them, so it's many, many, many cuts in a very small period of time. I'm particularly worried about that second toe. I think he might lose that. I am relieved that there's some toes there and a bit of his first toe.
We'll pop that back on gently. and you'll get as much pain relief as you need.
Dr. Sarah must now tell Alex the stark reality of just how badly his toes are injured.
Looking at it, look, you might lose the second toe, I reckon, but they will do their best to save as much as they can. I'll let the plastics guys know and we'll get some x-rays. You'll need to go to the operating theatre to have a look at exactly what's going on and save as much of the nerve and the muscle and the bone as possible.
A split-second lack of concentration could affect the rest of Alex's life.
Oh, silly person, man. What have I done? Yeah, it's just silly. I looked down and the top of my boot was missing. I didn't realise how bad it was. I want my big toe. That's the important one. Yeah, the other little one's fine, just the big toe's the important one.
We're about to take you for an X-ray, I think, of your foot.
It's really important that we get x-rays of Alex's foot and they'll show us how much bone is left. That will mean that the plastics team can build around those bones and maybe use some skin grafts to give him back some sort of big toe.
That's really good. All right, nice and still there. That's good. All right.
As Alex returns to the resus bay, Dr. Sarah can now see the full devastation of his injury.
That's not a great x-ray for Alex. We can see that the top two bones of Alex's second toe are just not there. These are the bones on the big toe, but they've been shattered into many, many pieces, and this is where the rest of Alex's big toe should be, and it's unfortunately been cut off.
There is a strong possibility that Alex could lose both of those toes completely and that the plastics team will have to amputate.
Hi, it's Sarah, one of the ED consultants.
Dr. Sarah urgently updates the plastic surgeons.
So it's the first and the second toe of his left foot. It's soft tissue and bony injuries. They're just both shattered. It's a fairly manky wound.
When I look at the wound, it's really contaminated. It's dirty. There's a lot of grass and some soil still in the wound. I know that infection setting in would be an absolute disaster in this type of injury, and it could spread and end up with Alex potentially losing his foot.
Like there's bits of grass and mank in it. It's pretty contaminated.
Dr. Sarah is on to the plastic surgeons about 46-year-old Alex, who's already lost a toe and could also lose his big toe after he stepped into the sharp blades of his ride-on mower.
Cool. See ya, bye.
Now having all the information, Dr. Sarah must let Alex know they may not be able to save his toes.
The x-ray shows what we would expect, where the bones in the toes are pretty broken in lots of places, but the bones in the big toe are there, but they've been shattered into many pieces. So the plastics team will come and see you, we'll wash it out and wrap it back up.
The best way to prevent infection is to get that wound washed out. We will put some saline, some sterile salty water through the wound. We've got to balance that with the pain that Alex will be feeling. We've got to do this as quickly as possible as well.
If you have to give me a number out of 10, 10 being the worst pain ever in...
7 or 8.
Emergency nurse Bab Shah acts quickly to get Alex's pain under control so she can begin to wash out his wound.
So we're just giving you a little bit of fentanyl. The thing is that the pain's so localised, you'll still feel that stingy burning, all that sensation. I'm going to start a flush through the wound just to get those dirt and sand and grass and everything off it. It's definitely going to sting. Just going to put a ball around that. Can you feel me touching there? Right, there, there. Do have a lot of respect for you looking at it while it's being done like this. I don't think I'd be able to do it. Alex is just calm and collected and just looking at the whole procedure being done. Alex not being visibly distressed and not complaining has definitely made my job a lot easier. Thank you for helping me.
Alex's foot can now be rebandaged, ready to go to theatre.
I'm Sarah, I'm one of the emergency doctors.
Hi, Sarah.
Hi, Sarah.
Alex's wife, Sarah, has finally made it into the ED to be by her husband's side.
There is a risk of infection in these types of wounds, and you will need, obviously, washed out properly in the operating theatre.
Alex is about to go into a really big operation. I'm not hopeful at all that they're going to be able to save Alex's toes. Losing a part of your body is really significant. He's got a really long road ahead.
One, two, three.
Dr. Emma and the team are changing the pelvic binder of 60-year-old Sharon, who could have multiple injuries after her car smashed into a pole.
Turn back on 3, 1, 2, 3.
Although Sharon's in terrible pain, they have no choice but to roll her again to get the new binder tightly in the right place before the old one can be taken off.
Oh no.
Little tip on
One,
the
2, 3.
That's it, well done.
Guys, wrong.
You good, you good.
That was it.
Might need to just try and lift her arm up on the side a little bit.
Success.
Sorry, it's at the moment. This will make it a little bit more secure.
The new binder is on and holding Sharon's pelvis tightly in place so she can be moved to the scanner.
We're just getting her sorted and getting her around to the scanner.
As the hospital updates Sharon's family,
100% she'll be here at least until tomorrow.
she becomes distressed about her mum, Leonora.
And I'll look after my mum. If I pass it, she'll have no one. And I really can't help her while I'm in here. She's only got myself to lean on.
And with all her worries, animal lover Sharon is desperate to find out what's happened to her beloved dog, Nemo.
Nothing can describe how much I love my dog.
Hello, darlings.
With Sharon's family so far away, emergency nurse Tanya Wallace understands how hard it is to be in emergency all by yourself.
You don't need to do anything but lie there and look pretty, okay?
When I look at Sharon and see how upset she is, my heart really breaks for her. So she could potentially have a pelvic fracture. She's got a broken arm already and she's complaining of pain in her ankle. It's important that we get her to CT quickly.
Hey Jana, it's Lisa.
Between patients, emergency Dr. Lisa Walker needs some assistance from emergency Dr. Jana on the ED floor.
I thought you might want to come help me give JPAP his birthday crown. I'm just at the main desk when you're free because I'm going to have to distract him because he won't let me anywhere near him. Fake.
And as Dr. Lisa predicted,
Just don't run away too far, JPAP.
Dr. Jonathan isn't too keen on his birthday headgear.
Oh, I'm not wearing that.
But as Dr. Jonathan hurries away, he walks straight into his next trauma that's arriving by air ambulance.
What's coming in here?
Post penguining.
Paraglider.
Yeah.
Yes, there's someone who's fallen out of the sky, possibly in a paraglider, maybe a hang glider. What we know is this guy's fallen from a huge height. Anything above 3 metres, any kind of injury is possible. People don't tend to survive falls more than about 10 metres.
30-metre fall. That's a big fall. Should we get the med pack?
Just get the med pack.
With such a catastrophic sounding crash, Dr. Jonathan and the team prepare the trauma bay for all possible injuries.
This is why you stay on the ground.
Exactly.
Go read a book, get a book club or a knitting club or something. On the floor.
On the rooftop, air ambulance has arrived with 50-year-old Brendan,
Hi guys, we need oxygen.
who was flying his paraglider when a powerful gust of wind made him plummet 30 metres head first to the ground.
Hey, my name's Ben. I'm one of the nurses here.
Hey Ben, I'm first too.
Are you?
Brendan's love of paragliding started 2 years ago when he got hooked on the adrenaline of riding warm currents of air high above the ground.
Hands are okay, which is good. Can breathe in and out, so that's good.
Self-assessment. Like it.
Brendan's son, Ronan, had gone paragliding with his dad. The first he knew about the accident was when he saw him lying on the ground.
When I got over to my dad, I noticed that his eyes wasn't opening, he wasn't responding, but he was breathing. This is the worst I've ever seen my dad, ever. He's a great person to be around. I love him very much. He's someone that I would miss if he was gone.
Hi, is this the hang glider man?
Paraglider.
Right, paraglider. We'll get him across and he can give us the handover.
Actually, did you say you're an emergency nurse?
I have worked emergency and paramedics.
Welcome.
Welcome back. Primary survey.
Dr. Jonathan immediately gets the team to examine Brendan for any threats to his life.
Let's go with the story.
This is Brendan paragliding. He was caught by a gust of wind at about 30 metres from the ground, pendulumed up and literally dumped headfirst into the ground with acceleration noted.
Big breath.
LOC, prior to my arrival, he was only just coming to. No recall of the event.
Yep.
Abrasion to the head. He's complaining of some right elbow discomfort.
This elbow was sore, yeah?
Pelvis appears intact.
So big bad mechanism. Wow. What you got?
Only area of concern is his right elbow.
And you did the lungs?
Lungs are okay.
How are you feeling there, mate?
Half my right elbow, everything's good, eh?
They thought you hit the ground head first. Does that sound right to you?
Yeah.
I've confirmed with Brendan that he's actually gone head first into the ground. If you told me he had no age of injuries, I'd tell you you were dreaming. He's got to have had some injuries. To be honest, I'm surprised he's alive. We'll X-ray, then we'll roll, and then we're going to CT.
X-rays coming. Yeah.
Well, I'm pretty worried about the mechanism, to be honest. There's a mystery factor here. How did he fall 30 metres without having significant injuries? How did he do it? It's a paraglider.
Determined to get to the bottom of what's happened, Dr. Jonathan tries to get more information.
So are you sort of in a sitting position now?
I've got a good harness with good airbag, so...
It's got an airbag. Maybe you're just pushing on the airbag. A paraglider has an airbag. Well, that's news to me. I can only surmise that Brendan's airbag has saved his life.
Chest X-ray?
Yep. So, Sam, the ultrasound conclusion, normal?
Yeah, all negative, yeah, all good.
Remarkably, it's confirmed that Brendan has no internal bleeding.
X-ray resun 5.
I'm just looking at his X-ray of his chest, which looks okay. There's nothing wrong. We don't see anything. That's a bit unbelievable. Nevertheless, that's what we're seeing. There's nothing wrong there.
As if he fell 30 metres and he's got a sore elbow and that's it. It's done.
Well, but he's got some sort of airbag thing he was saying.
Nurse Sarah Thomas was also expecting Brendan to have shocking injuries.
If all of you come out of this with is an injured elbow,
That'd be great.
you should buy a lottery ticket. Brendan's fallen from 30 metres. That airbag has had a major impact on saving his life. I absolutely stand by what I said. He needs to go out and buy a lottery ticket.
Dr. Jonathan immediately receives the scan results.
So this is Brendan's head scan. You would expect at least some concussion. Turns out this is looking pretty normal. We're looking at Brendan's head scan. We're worried that at least he would have a minor contusion or a bruise, but actually looks pretty normal. Well, that's amazing. Let's have a look at his neck. That's probably arthritis there, that's not a fracture. So his neck looks okay. We look at his neck scan, it's all looking normal. Head's normal, neck's normal. Are we looking at the right scan? Is this really the person who's fallen 30 metres and landed on his head? Because this scan does not look like someone who's done that. Brendan's got a sore elbow from the fall. He's got a fracture of his radial head. That little bit has come out of place. If his pain's well controlled, he could be walking out of here in a sling. So that's great. What a lucky guy.
Having established that Brendan doesn't have any immediate life-threatening injuries, Dr. Jonathan knows all that could change with more detailed investigation.
I wouldn't be surprised if more injuries are discovered in the next hours to days as he leaves emergency to be looked after by the other specialty teams. I mean, you'd have to have more injuries after this kind of mechanism.
Yeah, if I'm still walking and moving my limbs, I think I'm very lucky. Absolutely.
What's going on? This is supposed to be a cup of tea time, Shana.
It's nearly the end of a very special day for Dr. Jonathan.
What's? Oh, thank you. Oh, I've got the 60 years old. Thank you, 60. Thank you. That's ridiculous.
Dr. Lisa's been trying to give Dr. Jonathan the crown all day long. The crown fits Jonathan very well, so Jonathan should probably keep it on all the time.
Well, they don't go out. They're like spontaneously relighting.
Luckily, Dr. Chung has a glass of water to solve the problem.
Thank you. I'm saving a big bit for you, Chung.
And Dr. Chung's finished his cake just in time, as he's been called back to the ED floor with an emergency on the way.
GI bleed, he's had 2 days of H&M, blood pressure initially 65.
All right, I'll find a team. The guy's bleeding internally. We'll see. It's an elderly man. He's vomiting blood and he's also passing out blood through his bowels. So that tells me that he's bleeding from the stomach region and he's got a very low blood pressure. I'm very worried that he's lost a lot of blood. Nora, what time do you finish? Where are you at now?
I'm just about to go see you by an 8:30.
See this one instead.
Okay.
Working with Dr. Chung today is junior emergency Dr. Nora O'Sullivan, who's doing some training in ED.
77-year-old GI bleed, 2 days of hematomas.
The other hat that I wear in the department is of an educator, and I look after the juniors. It's a passion of mine. So I decided to work with Nora to give her the chance to upskill, to gain more knowledge, to gain more experience, and to manage a sicker patient. So what will you need?
It'll just basically be like where the source of the bleeding is, trying to resuscitate him from the fluid.
Probably the stomach, right?
Yeah.
So we're gonna give him stuff to stop the bleeding.
Yeah.
I know that Dr. Chung, if he approaches you to take a case, there's clearly a learning objective from it. When somebody presents with vomiting containing blood or blood from the back passage, it could be a peptic ulcer, which is an ulcer of the stomach. And in other cases, it can be things that are more sinister, such as an underlying gastric cancer.
Are you in here? In the H&M? Yep. You're in here. Yep.
The patient is 77-year-old Thomas, a missionary normally based in Kenya who's returned home to Australia for a few weeks.
Oh, he looks a bit pale, doesn't he?
Yeah.
Blood pressure dropped to 65. Peri-arrest. Okay. Peri-arrest means that there is concern that his heart's going to stop. And in this situation, it'd be due to the amount of blood that he's lost. It's a serious situation. He's probably going to need some blood, I think.
Yeah, I think so. I'm very ready.
Hi, Thomas. My name's Nora, one of the doctors. I heard that you had a bit of a rough day today, is that right? Yeah, what happened?
Firstly, my stomach was throwing up. I was getting nauseous.
Yeah, okay.
So I moved to the toilet.
Yeah.
It was dizzy and then blood.
How many times has that happened, Thomas?
Maybe 2 or 3.
2 or 3 times. And was it like blood clots that was coming up? Blood clots. And has that ever happened to you before, Thomas? No. And then recently, have you had any unintentional weight loss or anything like that?
Yes, I've been losing weight.
When Thomas tells me that he has had significant weight loss, there are alarm bells going off in my mind. Is this a red flag for a gastric cancer? I should probably ask Chung for some advice about the best management of this scenario. Basically, sudden onset. Yeah, you probably heard me.
Any history of it?
No history of it, no history of alcoholism. Unintentional weight loss over the past few weeks with night sweats. Yeah, so it could be like a cancer type thing.
Bleeding from there.
I'm very concerned at this point. He's had significant blood loss and he appears very unwell. We might need to resuscitate you with a bit more fluids, but we'll take it one step at a time.
Nurse Tanya is taking 60-year-old Sharon for a CT scan after her car smashed into a telegraph pole.
We're just going to get you all across onto the sick leave. I'm so sorry, okay?
Dr. Emma is worried that Sharon could have multiple fractures from the force of the crash and also compartment syndrome from her badly broken arm.
1, 2, 3.
Okay, Sharon, hot feeling coming now. We're nearly finished.
I'm looking at Sharon go through the CT scanner and just thinking about how her day started so differently, doing something so selfless for another person, and now she's here with us waiting to see if there is something very serious going on there.
1, 2, 3. Oh, right. Put that back on 3. 1, 2, 3. Oh, you're okay.
As Dr. Emma waits for the report of Sharon's scans, the team do everything they can to manage her terrible arm pain.
Just taking the splint away.
I know. So there's going to be some gentle pulling and some movement when we put the plaster on. It is going to be painful, I'm not going to lie to you.
If I swear, I'll apologise.
You're allowed to swear.
We've decided to plaster Sharon's arm, and that's going to be really, really painful for her as we put that bone back into place. As a nurse, it's really hard to watch any patient in pain. You don't want them to suffer.
I'm going to hold. You want to start wrapping? You're doing awesome. You're doing so well. Always been. All right, well done.
With Sharon's arm now in plaster, she can at last reassure her distraught mum, Leonora.
I think I've cracked my ankle and my arm together. They said I'm getting into a pole. So the pole crushed all in and as it was I'll be out tomorrow, maybe a couple of days.
Dr. Emma can now confirm Sharon's injuries.
Oh yeah, there. That's an unusual spot to break it, actually. Sharon's broken a bone on the inside of her ankle joint. It's a type of injury that leads to poor stability of her whole ankle joints.
I'm lifting up the leg now.
Yep. We need to put it in a plaster so that it's kept nice and still and stable while she's waiting for her operation.
Like a stirrup, like this.
Sharon has no memory of her car accident. Fortunately, her CT scan is normal, so she doesn't have any evidence of a brain injury.
All right, take it away.
Yeah, perfect. Sharon's pelvic CT is normal, so that's such a relief for her. She doesn't have a broken bone there, and fortunately, she doesn't have compartment syndrome.
But her arm is still badly injured.
Quite amazing, that picture, isn't it? That's the major vessel coming down there, but it's snapped off just there. Ouch. Oh, ow. Sharon's got both a broken arm and a broken ankle, so the orthopaedic surgeon will need to fix both in the same operation. That poses a long path ahead for Sharon in terms of recovery. It's a time that you really lean on the people around you, but Sharon's got people that depend on her. It's going to be a quite tricky time for her, both emotionally and physically.
We might need to resuscitate you with a bit more fluids, but we'll take it one step at a time.
Dr. Chung has asked Dr. Nora to oversee the care of 77-year-old Thomas as part of her ED training. Thomas has been admitted after he lost a huge amount of blood through vomiting up blood clots and bleeding from his bowel.
No history of alcoholism, unintentional weight loss over the past few weeks with night sweats.
One of the concerns is whether he's got something like a stomach cancer underneath causing the bleeding.
But before they can investigate the cause of his blood and weight loss, they need to make sure he's stable and not at risk of a heart attack.
So the question is, do you want to give him fluids or make room for blood?
Oh, we could do VPG and see what his hemoglobin is on the VPG because that's better.
And then make room for blood.
Yeah, okay, that's fair enough.
Good.
A venous blood gas test is a test that we do very commonly in ED. We're specifically looking at Thomas's hemoglobin level to decide whether we need to transfuse blood. We're hoping that Thomas's red blood count would be on the 120 mark. It's very concerning if it's below that. We're also going to check your full blood count to see the levels of red blood cells in your body. Thank you.
As the team run the blood tests, Thomas is thankful for the care he's receiving.
I'm a Catholic missionary working in Kenya, mostly in preparing pastors and missionaries in the field. I am glad that I am home, and because of that, I am here and I'm getting very good treatment. I think someone must be looking after me.
Thomas's blood results have come back.
Nora would like some blood. Looking at his hemoglobin and seeing that it's 82, we are concerned at this point that he has lost a lot of blood. So both Chung and I agree that it is best to transfuse him units of blood. So that's bags of red blood cells.
How many bags would you like to give him?
Probably 2.
Should be fine.
Yeah.
Okay. Thomas, hello, nice to meet you. I'm Chung, I'm one of the other doctors here. Now, you've lost quite a bit of blood, so your red cell count is right down to 82. So what we like to do is to give you some blood, all right? So we'll aim to give you 2 bags to get you up to at least 100. Now, with any blood products, there's always a risk of, infections, but the blood's really screened, and overall, I think the benefits will far outweigh any risk. There are risks involved in giving blood transfusions. The blood is screened, and the risks are very, very small. If Thomas doesn't receive the blood, I'm very concerned that he could have a heart attack. Would you like to sit up a little bit? I'll just bring you up. Oh, you bumped your head too, did you?
No, I didn't.
Yeah.
Dr. Chung is alarmed by the wound on the top of Thomas's head.
Did you black out?
I don't think I blacked out.
Okay. Nora, he's bumped his head. I know what I want to do, but I want to know if Nora knows that too. Do we need to scan his brain?
Probably because he didn't recall falling.
Nora makes the right call. She understands the significance of the injury and that he needs an urgent CT brain scan to rule out the risk of internal bleeding to his brain. So we need to scan his brain. Anyone over the age of 65, if they bump their head, they are at higher risk of internal bleeding.
But before Thomas can be safely moved to the CT scanner, the team must give him a blood transfusion to stabilise his blood pressure and prevent him from having a heart attack.
So do you want to aim the blood pressure at max above 65 or?
65 is fine.
Trying to get Thomas's blood pressure up, the team quickly pump blood into him.
And this one got how much?
237, is that?
237, correct.
After giving Thomas the blood, you can see his colour has returned, which is very reassuring for us.
How you feeling, my friend?
Not bad.
You feeling okay? Not dizzy or anything at the moment?
With Thomas now stable, he can be moved to have the CT scan of his brain.
We're going to scan your head first, okay?
While Thomas is being scanned, Dr. Chung and Dr. Nora see the effects of his extreme blood loss.
Looking at his sodium, it's fine, potassium's fine, but I can see that he's had a dip in his renal function. So the blood results are telling us that the amount of blood that Thomas has lost has started to affect his kidneys. Also just looking at his hemoglobin.
And he's anemic, isn't he?
He's
That
anemic,
confirms,
correct.
yeah.
That would explain why he's been feeling so lethargic and why he's so pale in appearance. We obtain a CT brain for Thomas, which luckily shows that there has been no bleeding in the brain. So that's one piece of good news for Thomas. Hi, Thomas.
Dr. Nora can now update Thomas.
We had a look at your bloods. Your red blood count was down a little bit. We also had a look and we saw that your kidney function had dipped a small bit as well. So we're going to continue to make sure that we're, giving you enough blood flow to the kidney. Thomas is going to leave the emergency department and he's going to go to the gastric ward where the specialists are going to do further investigations and find out what the source of the bleeding was. I think that Thomas is very lucky that he was in Melbourne. He could very well have died. I'll be saying a prayer for you anyway. Yeah, thank you.
Nora did very well today, I thought. She remained very calm. She was very organized, and I think reassured him that he was in safe hands. So we're actually hoping to try and recruit her to join emergency in the future, like next year.
50-year-old Brendan was choppered into the ED after a freak gust of wind sent his paraglider plunging 30 metres to the ground.
They thought you hit the ground head first.
Dr. Jonathan was amazed that he only seemed to have a broken elbow.
How did he fall 30 metres without having significant injuries? How did he do it?
We've got a good harness with airbags.
Maybe you just cushion on the airbag. I can only surmise that Brendan's airbag has saved his life, but I wouldn't be surprised if more injuries are discovered.
As Dr. Jonathan predicted, Brendan wasn't as lucky as he initially hoped.
I had a fracture on the right side of my face. I also lacerated my liver. I had fractured ribs.
But Brendan knows things would have been a lot more serious without his airbag.
When there's an impact, it accelerates the person.
I think without the airbag, I doubt that I would be here today.
You got your radio and your Vario pack? Yep, that's all in the cockpit.
As for getting back in the air,
Okay, let's go off and have a fly. Sounds like a plan.
there's no stopping Brendan.
It's almost like you dream as a child, flying through the air.
46-year-old security guard Alex stepped off his ride-on lawnmower and into the machine's blades.
You might lose the second toe.
X-rays revealed Alex's big toe had also been smashed to bits.
That's not a great X-ray for Alex. There is a strong possibility that the plastics team will have to amputate.
I want my big toe. That's the important one.
Despite their best efforts, surgeons weren't able to save Alex's big toe. But 2 months on, and with a lot of support from his wife Sarah, Alex is walking without crutches.
Oh, thank you.
All right.
And is due to return to work soon. 77-year-old missionary Thomas was rushed into the Royal Melbourne after he began vomiting up blood clots and passing blood when he went to the bathroom.
You've lost quite a bit of blood, so your red cell count is right down to 82.
Dr. Chu and Dr. Nora were so concerned about how much blood he'd lost, Thomas was immediately given a blood transfusion.
If Thomas doesn't receive the blood, I'm very concerned that he could have a heart attack.
They were also worried that the cause of the bleeding was very serious.
One of the concerns is whether he's got stomach cancer.
Thomas left the ED and was seen by gastric surgeons who discovered 2 burst ulcers in his stomach. After a successful operation to stop the bleeding, Thomas is recuperating and hoping to get back to Kenya soon. 60-year-old mum of 4 Sharon was airlifted to the ED after her car smashed into a telegraph pole.
Oh, ow. Good picture. That's sore.
Sharon had a badly broken arm and also a severely broken ankle. But all Sharon could think about was her elderly mum, Leonora.
If I pass it, she'll have no one. Some tight in there.
I'll make a gardener out of you yet.
3 months later, Sharon is at home recovering from major surgery.
I had an operation on my right arm. I had a rod, pins and plates put in that. My left ankle, I had pins and plates put in that as well.
With the support of her loving mum, Sharon's making good progress.
And how long do these take to grow, Mum?
Oh, nearly till summer.
Sadly, Sharon's family had to break some devastating news to her.
My best friend, my dog Nemo, was killed in the accident. He was my pride and joy. He was my everything.
Yosh! Come on, buddy!
Sharon's recovery has been made just that little bit easier with a new addition to the family.
Yoshi, come. Good boy. My children decided to get me a new puppy. His name's Yoshi. He's a Maltese cross Shih Tzu. He has sort of helped me recover. What are you doing? You're such a good boy, aren't you? Yeah, it's a good boy.